Today we will talk about, and I think it's perfect timing for at least the sister and I, right? We always talk about brain. I've been talking for the last 6 months to a year about brain function and the different areas and the 5 subcortical units, areas of the frontal lobe. We've got the parietal lobes, the temporal lobes, and the occipital lobe. So today, what I'd like to do, as I told you last week, we're going to go over some of them are tests and treatments, but the main thing I want you to take away from today is these are all treatments. Even if you don't have a problem, these could be, I use these to strengthen things. I use these as games with my kids. And the more, my daughters are the worst in the sense that they are the most competitive of the 5 of us. My 2 sons, myself, and my daughters. They are the most competitive. So if the guys start doing better when we compete against each other, my girls get so mad. I'm glad they don't get physical, but they'll walk. And Imam Ibrahim and his wife know my family. My girls can get upset and get competitive. Oh my gosh. It's a good time. But the idea is, what I'm saying is that it is literally, these can be used as games to help improve your function. You don't have to have any dysfunction to play these. That's the way I want to say it. You don't need any dysfunction to play these. And then I'll also mention, while I discuss them, I'll also mention if they apply to the right hemisphere, if they apply, how to use it for the right, how to use it for the left, especially with vision stuff. And we'll cover the frontal lobe, some parietal lobe, a little bit of temporal lobe. I also want to talk about the vagus nerve a little bit, and then a gigantic, if you want to search it up, a gigantic cranial nerve, and vagus is too. Vagus is cranial nerve 10. I'm going to also include the trigeminal nerve. That is number 5. And the reason these 2 are so important, and I included them today, is that, if you remember, is that they are in the brainstem. When I say cranial nerve, that means they're in the brainstem. And that's where the brain grows out from. That's where a baby's, and when I test and find it in adults, and it shouldn't be there, but that's where all of the baby's reactions and muscular activity, everything, that's where the baby stuff is. That's where all those primitive reflexes are. That's where everything starts. That's the hard wiring for movement. Babies looking around, moving all the time, and they don't know what they're doing until they realize, holy cow, that is my hand. Wow, I can actually do something with it. Then everything goes in the mouth, right? Because, what is it? The feet, the mouth, and the hands are so hardwired for sensitivity. So it's really important that brainstem area, and these are 2 big gigantic nerves in the brainstem, that area is functioning correctly. And these are 2 of the biggest nerves there, and it's really cool if you look it up. Cranial nerves 5, 7, 9, and 10 all run together, so they cross-stimulate. Cranial nerve 5 is trigeminal. That is facial sensation. And it's also really important with V1, V2, and V3, the facial control. If you don't feel anything up here, you don't even know whether you're smiling or frowning, right? That's the self-awareness. Cranial nerve 7 is facial, and that is actually the muscular control of those areas, right? So 5 and 7, it's important that they feel each other, they interact with each other. 9, we move back, and 10, vagus nerve. It's those cranial nerves the 2 I'm going to talk about today are hugely important for influencing that whole brainstem area. And 5 is up a little higher in the brainstem, and 10 is in the lowest portion of the brainstem. So it's really cool how we can stimulate that area. And then We're also going to be talking about, like I started with, frontal lobe, parietal lobe. We'll talk a little bit about the temporal lobe. We'll be using vision in this also, and then we'll add treatments for other areas also. So let's start with the frontal lobe. We've talked about the frontal lobe in terms of executive function, and I think in today's society, with all the worldwide craziness and poor behavior by whole nations. I mean, here we are, for us that are here in America, racism, sexism, every kind of really bad. We've got the Christian nationalism. We've got all these isms that are just taking over, and it's the exclusionary parts of a society. That's all executive function. Of course, most of those crazy people probably have retained primitive reflexes, if you know. But the idea is, I really think for us, for the believers, for the people in this audience, whether you're Muslims, Christians, or whatever, you be atheists. The idea is, it's really important to understand the frontal lobe, and we're going to start, most of my games today will be for the frontal lobe to improve executive function. Remember though, executive function is the last thing to develop, and everything, every sensation, everything that goes on in your head feeds into the areas that make the final decision, and then that final decision gets fed back to be done, whether you inhibit it or whether you initiate it. Whether you inhibit the bad and initiate the good, or you do the crazy stuff that's taking place against our brothers and sisters in Gaza and, of course, the West Bank. It's so we've got a whole bunch, and you can see it if you've been paying attention to this class. We've got a whole bunch of people that are not inhibiting. They are not doing anything. There's very little empathy in society for human beings. I usually talk about the big three religions here in America: Islam, Christianity, and Judaism. I apologize for anyone that's an atheist or a Hindu or anything else. I'm fine with that, right? That's your decision. But the big three, with reference to the Old Testament and New Testament, or the Christian combining the Old Testament and New Testament, the Jews who go with just the Old Testament and then all their interpretive books, the Talmud stuff, and of course Muslims with the Quran. We all agree that we all come from the same one and then the same two, right? It's all Allah, and then it's all Adam and Eve, Adam being created, then Eve is created from Adam with the same soul, with the same understanding, with the same, that knowledge, with the same level in the eyes of Allah, right? So we've got to remember that regardless of what you think or believe today, we all started in the same place. We are all humanity related to each other, although some of us have right now are clearly demonstrating our lack of humanity. But the idea is that even if it's just based on science, right? The migration out of Africa, we were all Africans first. So if you want to go with religion or science, we literally were related, whether we like it or not. And we really shouldn't lose our humanity and our empathy. And, we can't let the left brain just walk away from the right brain or the right hemisphere side. It has to work together. And what I'd like to do today, like I said, most of these games, after that long monologue, most of these games are going to be related to strengthening your frontal lobe. So let's get started on the games. And what you'll do, I'll go through these games, and then what you can do is, and I'll try to slow it down, if I spoke too fast, what you're going to do is ask me questions at the end, remember the game, and then ask the question, okay? Because I really want you to get these, because these really are that easy. The first thing for a frontal lobe, the first thing for frontal lobes is go, no go games, okay? That is training, as we just talked about, the initiation and inhibition. Go, initiation, no go, inhibition. So these are what you might consider rule change games. In my age group, it was red light, green light, Simon Says, two big gigantic go, no go games, right? Red light, green light, yellow light, red light, and you could move and not move, and move and not move, and move and not move. Simon Says, you could only move when he said something, when he initiated it with Simon Says. You might be in a competitive and you've got to jump the farthest and you're getting into the game and you really want to, and you get excited and he says, Simon Says do this, then Simon Says do that, do this. Oh, I didn't say Simon Says first, right? And you get caught up in the game. So it's about go, no go, initiation, inhibition, and rule change. So what you're going to do is, one of my favorites, along with red light, green light, I don't move as fast as I used to, and Simon Says, one of my favorite go, no go games, and you can all literally make it yourself, is called the Stroop test. Stroop. Stroop test. And so what we're going to do is, with the Stroop test, what you can do is literally, you're going to take, I like 4 colors of red, green, blue, and orange. You can use whatever colors you want to. If you are colorblind, then you can add other colors in there that are different than red and green. You could literally use the words and colors, black and white. Those would be real easy. And of course, white would be outlined with black lettering, if that's what you want to do. What you're going to do with the Stroop test is you are actually going to, I set mine up in rows, and it's going to, and you can do it however order you want to. But the first, there's 4 rows of 4. And I just go left to right and up and down, however you want to do it. And you're going to, typically you'll do, for example, red with a red color, blue, the word blue with a blue color, green with the word green color, orange with a word with a orange color, and then change the order, but it's still, maybe in this case now you've got green with a green color, blue with a blue, red with a red, and orange with the orange color. The next 2 rows are changed. So what you're going to do is literally, as you read through it, mix it up. Now what you're going to do is tell the person, read the word, or you do it. So you're looking at it in the words, red, blue, green, orange, blue, green, red, orange, yellow, whatever, however it goes. You read the word. You train it in, because if you speak the language, then your brain automatically initiates, especially if we're competing and we're doing this for time, your brain will jump on the word first. So I'm looking at it and I say, read that to me. And you read the words. Read the words, read the words. That's your base time when you're playing it as a family game, or you're training yourself. Set your phone next to you and go. Right? So what we're going to do with this is, with the Stroop test, again, it's the word with the matching color. And then what you're going to do, as you read through the words, boom, 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 you lock in on the words like I said a moment ago. Now we're going to go with read the color only. So that's the no-go or the inhibition part. Now, the first 2 rows, the color and the word match, right? Now the second 2, so that sets up that false security. Now the second 2, you're trying to go as fast as you can, and your brain likes to be continuous, or it likes that similar, it likes patterns, especially if you're left and you're competing. So what takes place there, with that in mind, is now the second one's, the color of the word doesn't match the word. So here you may have the word red in the color blue. So now your brain jumps right on the word because you're trying to go fast, but you've got to inhibit that initial reaction and initiate dorsal lateral prefrontal cortex, right? That's a lot of executive function, your frontal polar area. And now that has to, you want to stop the, you want to inhibit, then you have to initiate, no, read the color, not the word. So you don't read the word red, you announce the color blue. Then you do not read the word green, you announce or tell us what the color orange is. Does that make sense? So that's how you do the Stroop test. And if you want to do it with just words, no cards, you can literally use those same 4 colors and say the first 4 you do, the color matches the word. Then the next ones you write down the word with a different color. So you don't even need, you could literally just write it across a sheet of paper and read through that paper as fast as you can also, if that makes sense. And that's the Stroop test. Now what we want to do, another favorite of mine, is the FAS test. Because typically the FAS test, you use those 3 letters. And what you do here is you are going to use those 3 letters and pretend I say F. You want to come up with, you can't use, as this poor cat has, you can't use any curse words, and you don't want to use any names or nouns, okay? And you don't want to pluralize anything. Like if you use the word fast, or maybe you said faster, you can't now say fastest or fast. Does that make sense? So what you're going to do is you've got 1 minute to run through as many words as you can with that starting letter. You could use any letter you want to do this test. The standard test is F or A or S. You could use B, you could use C, you could use D. You could use any of the letters you want to. And what you want to do is you want to hit 10 words in 60 seconds. That's normal. 12 is above average, and 8 or less than 8. 8 or less could indicate a concern in terms of dementia, Alzheimer's, and just overall brain function. So what you're going to do is you're going to pick a letter, 1 letter, and start every word you can think of with that letter. You could use, like I said, if you use the letter B, for example, you could say the word B. You could use the word best. You could use the word bat. You could use the word baseball. You could use the word breath. You could use the word bleed. You could use the word brain. You could use the word, if I didn't say beat already, I'll say beating, heart beating. And run through that and try to get at least 10. I guess that was like 9 right there. And you run through that in a minute or less. And then, like I said, you want to get, if you can think of 12 words, a new word every 5 seconds, that's cool too. That's above average. 10 is normal, and 8 or less is below average. And then you just practice and train these words. And that's your FAST test. And these are all frontal lobes. And the FAST test is really cool. I like that because what we're doing is we're strengthening the verbal skills and that would be a left hemisphere issue, okay? After this FAST test, there's also what we call, and the sister mentioned it with her mini mental exam. You could, for example, partners, the one spouse gives you 3 words. And as soon as they walk in the house, for example, you guys could try this tomorrow. As soon as you get home, give your partner 3 words. And then about an hour later, or even just before you go to bed, an hour, 2, 3 hours later, ask them for those 3 words. Really smart is in order. Average recall with long-term memory, average recall if you want to go more than if you go an hour, that long-term recall is 2 out of the 3 words. The order doesn't matter, but if you nail the order, that's well above average. If you remember all 3, that's above average too. The average is 2 after an hour. After that one, and you can also use, the next one is similar to that in terms of recall. This is called digit span. This is where I'm going to give you, we would use 4, 5, 6. I think the normal, I should have written it down. Yes. What you're going to do is I'm going to give you numbers and you're going to repeat them to me in order. And I might say 3, and please write them down so that you remember. But for the person you're clowning around with, write down a bunch of numbers, single digits. Write those digits down. And then give that digit, they repeat it. Give the next digit, they repeat it. Give the third digit, and they repeat them. But they repeat all of them. So I might say 3, and you say 3. Then I'll say 3, 4, and you say 3, 4. Then I'll say 3, 4, 7. You'll say 3, 4, 7. I'll say 3, 4, 7, 2, and you'll say 3, 4, 7, 2, and then okay. You should be able to get at least 6 numbers. You want to get really challenging with that. You do that. I give you a new number all the time, and you give me each number back, and I only gave them to you as single digits. I might say 3, you say 3. Then I might say 5, and you say 3, 5. And then I'll say 1, you'll say 3, 5, 1. I'll say 4, you'll say 3, 5, 1, 4. And you work your way all the way up to giving me back the 6. Then what you do, when 6 becomes easy, now what you're going to do is give them to me backwards. 3, 3, 3, 5, 3, 5. 3, 5, 4, 3, 5. Oh, I'm sorry, and I'm giving it to you in order. 3, 5, 4, 5, 4, 3. 4, 5, 3. So that's the challenge. What you're going to do is digit span. I give you the number, and then you recite them back to me out of memory. Okay, so I'll give you the one number, you'll give it back to me. I'll give you a second number, you'll give them back both to me in order. I'll give you a third number, you'll give them back to me in order at 3. I'll give you a fourth number, you give them back to me in order at 4. The normal there is up to 6. If you can go 7, 8, and 9, I'm cool with that. Go until you can't anymore. Literally, overtrain if you have to. And then digit span, the harder version, is I give you a number, you give me the number. I give you a second number. You give me the second number, then the first number. I give you a third number. You give me the third number, the second number, and the first number. I give you a fourth number. You give me the fourth, the third, and the second, and then the first. 4 backwards is minimum. Okay, that shows normal function. Try to get it up to 5, 6, and 7. A lot of the people say, depending on age groups and all that stuff, we should really high functioning brains should be able to take it up to 7 in reverse, 6 in reverse, 6 and 7 in reverse. So that's the digit span. If you want to, it's also kind of fun. You throw letters in there once in a while. It's also kind of fun if you throw words in there once in a while. There's no standard for those, but it's just fun to provide a variety of different. And when we're doing math and letters and words, we're over here a lot. And that tends to be word selection up front, letters understanding, word understanding, definition understanding, definitions back here, and putting it all together so that then we can say it, the meaning of words and phrases and subtleties and jokes and sarcasm, those are over here. Okay, so that's how the right and left work together. That's called the digit span test. Now, this is these alternating hand tests, frontal lobe, but not just verbal and memory skills. I really like alternating hand sequences. What you're going to do here is literally the easiest one. The easiest one is going to be one hand up, one hand down. And then you just alternate as fast as you can. And you can use a metronome, boom, 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 right? And that's the way you go. All right, that's just the alternating hands. And then it's one hand, one up, and then train that in, right? And then, then switch and see what you can do there, okay? Then we take that, after that we go with one open and one closed. And there, it's just this, okay? And you try to keep it going at the same time. And after a while, you start to fall apart and you tend to go like this. Go as long as you can with that. Train it in and time yourself and see. That's the competition of who can go longer. Then we have the real hard one is, whether you can see it or not, what you're going to do is, you can't really see the hands here, but say my right hand is going to be on the 1 beat. My left hand is going to be on the 2 beats. Okay? So it's now, and if you can time this to a metronome, huge important. Every time you hear the beat of the metronome, you're going to do that. Every time you hear it, it's okay. Now, after you train that in, and that's your baseline, whichever one you started with, your change is, now my left hand is the single beat and my right hand is the double beat. So it's, and you can see I'm really concentrating. All right. So that's the alternating hand sequence. The simplest one is 1 up, 1 down. And then the next one is one's open, one's closed. And all you're going to do is alternate. Well, at the same time, all you're going to do is alternate there. And then you switch it, right? And start differently. And that just, it really will feel different. Then the last one is going to be the beat. One is a single beat. The other one is a double beat. Right? So you're bang, bang, bang. And then you switch. Bang, bang, bang. All right. So that's what we're taking place with the alternating hand. And why I like the alternating hand stuff is that also brings in some big time, right, motor units. That's going to stimulate some stuff in the deep part of your temporal lobe with your basal ganglia and automated or automatic movements. And then it's also going to bring in some cerebellum, and you're using both hands, so it's both sides, basal ganglia, cerebellum, and the sensory motor area and motor function. That's going to bring in and tie all those and train all of those together, and along with initiation and inhibition. So you're cross-training the right and left hemispheres. Hugely, hugely, hugely important. And those are great, great frontal lobe, inhibition, initiation, appropriate initiation games. And then you can see yourself getting better with that stuff. Or you can see someone that can't do 4 numbers backwards or 6 letters forward, as you give them 1 letter and one number and 1 number and 1 number and 1 number, and they recite them back to you in order, or they recite them back to you in reverse order. Some of my favorite games. Then there's also, now what we can do real easy is bring in some vision tests. Really important. Now we're going to go with hemispheric stuff, literally stimulating, and we're going to use, in this case, I'll start with a parietal lobe. That's very important for sensation. That's very important for your, for example, your where is it vision. Your parietal lobe, believe it or not, your occipital lobe, most people know the back of your head is for vision. What most people don't know is then your parietal lobes help with the where is it in your vision. If you pick up a movement, you know to get to it because your parietal lobes go with where is it. And then as you go with where is it, your temporal lobes get over there, or once they get over there, your temporal lobes are trying to figure out what is it? Is it sharp? Is it dangerous? Is it safe? Is it soft? Do I catch it? Do I duck from it? All of those questions, what is it, is your temporal lobes, and where is it is your parietal lobes. So believe it or not, those are also important to vision. So with vision, a real cool parietal lobe test, or training, is pursuit. And what you can do, and it's literally like this, what you're going to do is you'll hold your hands. I like to hold my hands up. I'll put them out here just because, but it doesn't matter how close or how far. Typically, when I'm in the office and I'm testing someone, I'm anywhere from 10 to 18 inches, depending on what I'm doing, which is just shy of the arms, like where I am right now. So what we're going to do here is the parietal lobes pull the eyes to that side. Does that make sense? The parietal lobe pulls the eyes, so it's parietal and pulling, to the same side. Very important. So I'm going to do this. Everyone can see. Now, what I do is I'm going to try to keep my head steady, but what I'm going to do is I'll show you with just the fingers first. My thumb is going to move from the middle to the right. So what I'm trying to do is stimulate my right parietal lobe with this movement. So now this thumb stays for a reason, and I'm going to do my parietal lobe, and here it is. My eyes are moving to the right with my thumb, right? That's parietal lobe stimulation. Now what I'm going to do is take my eyes, and I'll show you, make it for all of us here. Now what I'm going to do is don't move this thumb, jump my eyes back to the thumb. So now I go from way over here to my eyes jumping back to here. That is a frontal lobe stimulation from the same side. Remember the words parietal lobe pulls the eyes, frontal lobe pushes the eyes to the other side. So what I do is I'm literally stimulating this whole right hemisphere. So if you're a person that doesn't get the joke, if you're the person that feels like they don't have enough empathy and understanding for others, if you're the person that OCD, very, very strong left hemisphere. A lot of OCD is extreme. A lot of engineers, surgeons tend to be, they may be very caring, loving people. Hopefully that's why they got into it as doctors, right? Some of the best surgeons are literally very, very strong left. They know exactly fine detailed movements. Oh my God, that's the surgeon. You want somebody that's good with fine detailed movements, right? So that would be a strong left brain. Well, if we want to improve the right hemisphere, then what we would do is literally we'd parietal lobe that stuff on the right, wouldn't we? Again, we pull, and then the eyes jump back. And then you bring the thumb in. Then we pull all the way out. That's as far as I can see. Now my eyes jump back. So what we've got is, this is called pursuits, visual pursuits. And then when the eyes actually jump back, that's called a saccade, S-A-C-C-A-D-E. Easy stuff. You can do this at your desk, and you can literally train both hemispheres that way. Now if I'm going to do my left hemisphere, I've got my thumbs up here. Now I pull, yes, and then the eyes jump back, and then I bring the thumb to it. Then I pull, then the eyes jump back, and then I pull way over to the corner of my vision, way out of there, and then my eyes jump back, and then I bring the thumb in. You don't want to pull back because you're strengthening the opposite side, right? So I'm strengthening my left by pulling to the left with the vision all the way out there, and then saccades, boom, back, and then I bring my thumb in. That would be left, right? I'm pulling to the left, then I'm pushing to the right. And if I want to strengthen my right, I pull to the right, and then I push to the left. And that's how you can use vision to strengthen both your frontal lobes, and remember the frontal eye field, and then you're using your motor centers to involve that, right? And then the frontal lobe for the pushing, the parietal lobe for the pulling. You can also use for vision some of the simplest things. I had a patient that was involved in a car accident, and pretty traumatic. She got knocked off this, driving up the highway. Somebody came up on her, passed her, and cut in way too quick, hit her car, knocked her right off the road. The fear of death, everything, okay? She survived, but not completely off the road, into the grass, into the, oh my goodness, the highway's 70 miles an hour down here, right? Well, it's 70 miles an hour at least. Morning rush hour traffic, boop, she gets knocked off the road at 70 miles an hour. A couple weeks in, I'm adjusting her, and she and her husband are there, and she is really emotional that day. And I asked her what's up, and she told me it's really, the driving, the anxiety is getting worse and worse and worse. And of course, then we had an anxiety talk, right? So at that point, I said, and she used the term anxiety. So I said, what is the anxiety? How do you feel inside? Describe your feelings. And I'm not a psychologist. I'm not a psychiatrist. I just know we had a lecture about anxiety, left brain anxiety and right brain anxiety. And it was all emotional. It was she kept saying, oh my goodness, it doesn't even make sense. It's just this fear, this every time a car starts to pass me, I panic. There's plenty of room, I can see it. And she's literally logically explaining it to me. All the logic is there, right? So that means it's all emotional. It's self. It's way too much emotion, not enough logic. Because she keeps saying, I know I've never had an accident before, and it's the chance that it's going to happen again, and it's just not, and it's this, and it's just. So I said, all right, listen, try. All I said was try this, and she went ahead with vision. Because what were we talking about? We want to stimulate the logic side. We want to make her logic stronger while she's driving. You've only ever had one, you're 30, 40 years old, and you survived. So I told her about red, stimulate the colors, red, orange, and yellow to stimulate the left brain, yes? And I said, why don't you try, just try, getting a pair of $5, $7 glasses at Five and Below or any of these, something that you can see through clearly, but it has a red, orange, or yellow tint. And red is a stronger color. I said you should start with red or a variety of red, some kind of pink if you feel good in that. I'm fine with that. And wear them. You can wear them all the time or just wear them when you drive. She did it, and I was so pleased for her that she came back and she said, I put these glasses on every time I drive, and her anxiety was down to almost zero. And it wasn't psychology, it wasn't psychiatry, it was neurology. And knowing neurology and knowing that her reaction was darn near PTSD, right? Post-traumatic stress disorder. And it was heightening in that situation. And the right brain doesn't have a time frame. So she knows there was a crash. She knows she got knocked off the road at 70 miles an hour. She knows she was fearing for her life as she got knocked out of the lane, off the shoulder of the road, into the grass, and along our area of 95, that area she was in, well, there's more businesses up there. There's more trees down here. They find cars in trees at this end of where we are. And she threw on the red glasses. Whenever she drives, she says her anxiety is almost zero. She still gets a little anxious, but she said it doesn't affect my driving like it used to. She said she used to want to cry. And now she's just thrilled that the red tinted glasses made a difference. So if you are trying to stimulate, say you're a hyper emotional, a hyper right brain side. Now remember, when I say emotional, I mean fear-based emotions, not anger-based emotions, like the person that was cutting in and cursing at me all the time. That's more of an anger thing, and that's too much left and not enough right to inhibit the inappropriate behavior. And of course, then I'll make jokes about it for the next several weeks probably. But the idea is that that tends to be anger-based. But sometimes it could be, fear. Fear can be expressed as anger. So there's always a little more detail than that. But for the most part, left brains are only angry, happy, or surprised, and right brains are everything else. Embarrassed, ashamed, disgusted. They feel empathy. Happiness and joy are over here also. But this is the side that tries to be socially appropriate, and this is the side that doesn't care about being appropriate about anything. It's just about impulse and everything it thinks and everything a left brain person does and everything. They're right. And we know some of the people we have up making national decisions are very left-brained right now in our society, actually all over the world. So that's what we're looking at. So you can use the colors red, orange, and yellow to stimulate left brain. And if you need right brain stimulation and you need more empathy, like a lot of our world leadership, then you can use the blue, green, and indigo colors. And literally just a tint can stimulate those two areas. And then there's some real cool studies. There used to be a video that showed a guy had a movement control problem, not Parkinson's. It's called dysdiadokinesia, if I'm saying that correctly. You can look it up, DYS or DIS. Diado, D-I-A-D-O, dysdiadokinesia. I think I'm using the right word, meaning totally inappropriate movement. You know, you're trying to initiate something, and he was all over the place when he tried to get up and walk. And the color cobalt, specifically cobalt blue lenses, to control that movement. They put the glasses on, he was up, everything was smooth. They took the glasses off, he was all over the place again, put the glasses back on. So colors actually stimulate neuronal function. There's certain chemicals and the neurochemicals are released. Vision stimulates that stuff, hormonal, neuronal, hormonal release, neural control. Vision stimulates, and colors stimulate vision, or can do that also. So it's red, orange, yellow, blue, green, indigo. Next would be the vagus nerve. Hugely important. The vagus nerve is, and you could Google this stuff up, search this stuff up, whatever. Vagus nerve, this stuff works. Cranial nerve 10. Be very careful because there's a lot of craziness out there too. I'm only going to give you two things that are real easy to validate, and I'll give you their whys. I really like Dr. If you want to follow someone, or go, you don't even have to follow him, but you can, because he's always putting some really cool stuff out there. Young guy out of Atlanta, Georgia. Dr. Ryan, R-Y-A-N, Cedermark, C-E-D-E-R-M-A-R-K, Ryan Cedermark. He comes up with such cool, and you'll see I repost a lot of his stuff. He comes up with these really cool slides with one piece of information, or you might scroll through for two or three things. He has a lot of accurate vagus nerve information. Deep breathing. I'm going to talk about stimulating the auricular branch, stimulating through the abdominal cavity. That's what I'm going to talk about today. But it's Ryan Cedermark, C-E-D-E-R-M-A-R-K. You can go to his Instagram page, boom, 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 and I really think everything's morally appropriate too. I don't remember seeing anything on his Instagram account that I would be embarrassed to post on mine, I think. Some great stuff though. So what I'm going to talk about now is the vagus nerve. Hugely important, because that is P-A-R-A, sympathetic, without emotion or ramping down your emotional response. Really cool. And I prefer if someone else does it, but it also works if you do it. And I actually bought these just because it was neat. But what you can do, stainless steel, Chinese medicine stuff, they consider this really good. But what you're going to do is literally right on the edge. You can't really see it. It doesn't go in the opening, in your ear canal. It's just the outer edge. And you want to look up. And that is the only place that the vagus nerve comes to the surface of the skin. And it's called the auricular, A-U-R-I-C-U-L-A-R, auricular branch of the vagus nerve. And that's important because you are now directly stimulating the vagus nerve from outside in. That's why some people lay Q-tip for hours. They can rub that area. You can do it yourself, but I don't think this doesn't give me the same stimulation or the same stim that using, say, a Q-tip. It doesn't go in the opening, right on the edge, literally right on the edge of the opening there. And that's the auricular, A-U-R, auricular branch of the vagus nerve. And you can stim that, and you can stim both sides, and that will stimulate the vagus nerve. And that is the ramp you down nerve. That is also hugely important, the vagus nerve, deep breathing. And you can use 4 seconds in, 7 seconds out. You can use something, all these different things you'll see out there that box breathing, and you breathe in all the way and then you breathe out, and all these timing things and different things. The big thing is, think about what the vagus nerve is doing. It's important to your heart rate, it's important to respiration, hugely important to your abdominal cavity. One of the biggest stimulations, and that's why comfort eating really relaxes people. Swallowing, digestion, that stimulates the vagus nerve. So there's two different types of people in terms of emotional when it comes to eating. One eats like crazy. They're trying to subconsciously, you're literally trying to stimulate the vagus nerve by eating. And you found, coincidentally, most people aren't aware of it, that they are eating, it calms them down when they get emotional. I swing the other way. When I get emotional, I don't like to eat, because what happens? It's parasympathetic vagus nerve or sympathetic not vagus nerve. So if my emotions are high, I don't find it easy to stimulate my vagus nerve to work digestion. Does that make sense? So I'm feeling emotional, so I don't want to eat. It's just the way I'm wired. Other people, they literally, okay, comfort food. The minute they start getting upset, they eat because their digestive system turns the vagus nerve on. So there you go. You go from being real angry, real emotional. Then when you eat something and you're drinking something, and that chewing, and then the swallowing, and then the stomach's coming on, and all your intestines are coming on. It's literally like dogs. You feed a dog, you better get that dog outside within an hour to two after eating, right? Because that's part of digestion, not just the saliva starting, like being my age, and a lot of you, we remember when people used to cook everything. There were no microwaves. You could smell dinner was getting ready, right? You knew that stuff was coming. And that starts the salivation, that turns your digestive system on. And you couldn't wait to eat, right? It was all primed and ready to go. Now we get home, we throw it in the microwave, we throw it on the table. We don't prime anything. Now we're not 100% engaged. Some of us may not even be salivating yet. So the idea is the vagus nerve is all about digestion. So literally, comfort eating may calm those people down. And other people, when they get emotional, they start losing weight under stress, right? Some people gain weight during stress, some people lose weight during stress. And that's the reason. Digestion is almost, but not completely. Digestion, the vagus nerve has a huge control over digestion. So what you have here is comfort eating can turn the vagus nerve on, or the emotions can turn the vagus nerve off and you don't feel like eating. That's how that would work. So then think about what I'm about to say, the deep breathing. That diaphragm, every deep breath pushes down on your digestive organs, every breath out releases, so you're literally breathing in a massage, right? You're breathing in. Then, think about what I'm going to say now, massaging the abdominal cavity. And this is a case where a single me can literally massage the abdominal cavity. You could do this for your spouse. You can do this for your kids. We did it to a patient. Really funny story. Great person. What we did was, it literally, she couldn't go to the bathroom for, she hadn't pooped for 3 days. 3 actual days. And I use a lot of red light and infrared in my office. Cold laser. It's actually cold laser. There's some cool devices on the internet that you can order. Be very careful. Some of them really do work though, because I've bought some of them also. But the idea is that I use an actual really expensive device that's actually considered class 3 cold laser, if you like looking that stuff up. And what we did was, we did cold laser over the abdominal cavity for approximately 5 to 10 minutes. And then soft tissue, very gentle massage, just enough, nothing should hurt. All you're doing is applying that little pressure, that little rub throughout the abdominal cavity, because your intestines are huge in here, aren't they? They are like your intestines are all over the place. What is it, like 3 miles, I think is the number? So literally every little push sends a message into the vagus nerve, right? And that tells your brain, wow, there's something going on in my abdominal cavity. My vagus nerve is getting stimulated. That ramped her down. She's a very emotional individual. That ramped literally the 5 minutes of lasering and the couple of minutes of abdominal massage, and she's on the table and there's no way this is going to work, but so much had worked before, so she gave it a try. Literally within 10 minutes of coming in and lying on the table, we finish, and immediately she is laying there and says, yeah, this is just, there's no way. And as soon as she said that, I knew what was up. There's no way. No. And she pops up. She runs into the bathroom, and I'm not, no exaggeration, it was boop, boop. And she ran into the bathroom, and for her, that was all it took. And it literally, she pottied and then came back out, and just, there's no way that works. But again, that's neurology. It's knowing that the vagus nerve controls this area, and you literally, it's like you start massaging this stuff, and it stimulates the vagus nerve, and that can ramp up your non-emotional side. Does that make sense? That's a lot of explanation, but that was I'll never forget that story. Hopefully that was funny, because it was that was immediate. Other patients I've had to take, it'll take longer. It takes longer, but it really is a great influence. And for example, constipation. It's also, even if you're not constipated, okay, it's not just that. You can also, to ramp yourself down emotionally, stimulate the auricular branch, stimulate this gigantic, literally, you've got a lot of intestines here. So stimulate that area with soft tissue, just gentle rubbing. Press, just try to relax enough and press, and just not to cause pain, but just to send a sensation where the intestines are like, holy smoke, something's happening. There, your liver, your gallbladder, and stimulate those organs. That'll stimulate the vagus nerve, sending a message up, and that may be enough to ramp you down, along with any deep breathing, a real cool deep breathing. And I believe it's on Dr. Cedarmark's Instagram page, where you breathe in as deep as you can. And I rush that. But what you're going to do is fill your lungs up as deep as you can. Then you saw that second, and you just try to get that last one in, and then you breathe out. And most research involves approximately a 7-second exhalation for most deep breathing stuff. So you breathe in as deep as you can. When you really think you're full, that last one, and then breathe out. And they recommend breathing out through your mouth. A lot of times I forget, and I'll breathe out through my nose. But I do find the deep breathing, actually, it does. It helps relax me a lot. And then with those two, so it's the auricular branch and abdominal massage, abdominal cavity, not just your abdomen organ. And then finally, the trigeminal nerve. That is hugely important because, like I said, it's such a big, gigantic nerve in your brainstem, just inside your skull. That trigeminal nerve is everything. And it can be as simple as, and if there's any young parents out there and you've got newborns, you have newborns, then this is a really cool way to calm down babies, because they are all learning, all feeling, all awareness. It's just awesome, right? But what you'll do is massage the face very gently all over, stimulating the facial nerve. And again, spouses, do that for each other. Somebody has a hard day at the office. This stuff is no joke. It really is. I see all these commercials and these advertisements for barbers, and they do a little of the massage, then they sprinkle warm water, they steam the face, warm towels. you are stimulating the trigeminal nerve, and all that facial area, super, super sensitive. Because remember, your face is what we look at to make sure that we're reading people correctly. Your facial, that facial area is huge between cranial nerve 5 and cranial nerve 7. These two, you got the facial sensations and feeling and aware of your own face, and that helps you learn how to read other people. And then the cranial nerve 7, the facial nerve itself, 5 is trigeminal, 7 is facial. That's the movement stuff, the smile, the frowns, the actually moving and stimulating 7, like I said, 5, 7, 9, 10, and some say cranial nerve 11 also. 5, 7, 9, and 10. Then imagine chewing, eating stimulates, that's number 7, right? Facial movement. Chewing and eating, that's going to stimulate 5. It's also going to stimulate 9 and 10. 10 is vagus, right? It's important. So literally massaging, just nice, gently. You could use, we also do a lot of teeny tiny, small, not the thin kind, more of the small squared off paint brushes. But when I'm trying to stimulate like the palmar grasp reflex, I could use my finger like this, or I use a pen, the end of I also use the end of a reflex hammer. You can use your finger. You can also, when I'm trying to get rid of, the palmar grasp reflex is you put something in a baby's hand and boom, they close right on it, don't they? It's this. That's a good palmar grasp reflex. That should be there, right? Now, what we do is, in an adult, that shouldn't be there anymore, all right? It's a brainstem thing. The brainstem is there. You're hardwired, and then the rest of your brain grows over it, and it becomes, it's bottom-up growth, front and back, side to side, and then it's top-down control. So that palmar grasp reflex should be gone. To get rid of it, on someone that's more than a year to 2 years old, to get rid of it, I use a light paintbrush. Or if they're older kids, believe it or not, any elementary, middle school, even high school kids, the idea is you have them play with a tennis ball. And that stimulation will help get rid of the palmar grasp reflex. If they've got they can't hold pencils, pens, they can't write, horrible, horrible writing, and you can see it. It's a grip thing. That may be a palmar grasp. And that's, again, I would use a light paintbrush. And the reason I bring that up is that's what you can very gently massage your face or your partner's face. Imagine your husband or your wife tells you they had a horrible day. And it's like, baby, I'm going to go get the paintbrush. And it works. I'm telling you, it works. Stimulate the auricular nerve, the auricular branch, paint the face, gently paintbrush the face. No jokes. Don't trick each other, because then you don't relax and you're never comfortable. No, paintbrush the face. You might be able to actually reach the auricular branch, I think. And those two, stimulating 5, helps relax everything, because that's going to cross-stimulate 7, 9, and 10. And then this will stimulate 10, which will then cross-stimulate 9, 7, and 5, right? And that's a whole lot of calm. That is a whole lot of calm. And that would be literally the trigeminal nerve. Are there any questions from our social context, culturally appropriate audience? Would you like me to repeat any of the tests?
No, I enjoyed Dr. Go ahead, Anissa, I'm sorry.
No, I was going to say, I enjoyed it too. I could do the hand test. That was easy. One up, one down, and 2 I could do that real good.
You've got that sharp mind, sister.
Listen, my 99-year-old mother was listening. You know what she said? Bull.
She said what?
She said bull. In other words, she wasn't paying attention. She wasn't catching on, and it was a whole lot for her to take in. She said, bull.
It gets challenging.
I know he's a real doctor. He knows what he's talking about.
This isn't fake stuff. Yeah, this is a
Yeah,
good time.
right. Oh gosh. Go ahead, Layla.
Okay. I have a problem when I'm reading.
Yes.
Sometimes I skip over a letter,
Mm.
and I'm trying to get better in like zooming in, but sometimes when I zoom in, I stay in that one area and I won't be able to say the whole word. Does that sound? I mean, because
Yeah.
I'm working on Arabic,
Yes.
so like I know the letter, so I stay there on that letter, and then he's like, he wants me to. He's kind of ushering me to go to the next letter, and then sometimes I go too fast. Sometimes I'll go to the next letter and I skip over that one, and I won't get the word correct, or
Now-
I'm trying to. I don't know. I don't know the balance or a trick to kind of
Maybe
zoom my
let me
eyes in, or what?
yeah, let me jump in because
Okay.
if it's the I'm going to go with the fact that pretend it's all English or Arabic. It's letter to letter. It's straight. It's the letters, and you know where the cuts are, and you know everything. Like I recognize the English stuff. So what happens with vision and reading? It could be a quick test you can do with yourself, or have your husband or children do with you. Have them do it. I'll do it for myself, but have them do it. And you're going to look at their finger. Okay, so everyone can see that. What you're going to do is you're going to look at that finger, that thumb, and pick a spot on it, or draw a line right up the middle of the nail, or put a little ink mark at the top. You're going to look right at that spot. And then what you're going to do, and I have glasses on, so that messes with me a lot. But what you're going to do is literally slowly but surely, and in your case, you want to see one thumb the whole time. You want to see one thumb the whole time. There. You should be able to get within, I just lost mine. Now I'm looking at two thumbs. So now you'll see I'm changing my expression. I'm trying to focus that in. I'll move back to where it's one thumb again. Got it? Now I train it in, and there I lost it again. Now it's two thumbs. What happens is I've got a strong and a weak eye. And I know this. I've got a strong and a weak eye. And what happens is when I start to get really challenged with something, my strong eye and my brain takes over with that eye. So what you could be doing, maybe you're getting fatigued, or you find the letters challenging, and following the letters and stopping and starting, what you can do is train that in better. One of the ways that what your husband or your kids are going to look for is, and one of my children actually does it. We do like this, and we get to a certain point, and the one eye completely falls out. She cannot bring the eyes together. And what happens is we get to a certain point, and that the strong eye stays on it, and the other eye matches what we call, I'm going to say this, you don't have to remember it, there's medial rectus and lateral medial movement and lateral movement. And there's two muscles, your medial rectus and your lateral rectus. And when I'm doing like this, what happens, pretend my strong eye is pulling my right eye medial. If this is weaker, then say this side, this brainstem area, cranial nerve, that brainstem area may be weaker. So what happens is this one takes over and they both go medial, or they both pull in the same direction. Does that make sense? But you don't want them to pull in the same direction. You actually want them going in opposite directions, meaning come together over your thumb. So what you can do is you can train that in better and see if that doesn't work. They have...
So I bring my thumb towards me gradually.
That would be it.
Okay.
And I like it better if someone else does it, because you can do it. Don't get me wrong. If there's nobody else to do it, you do it. Because like I just showed you with mine, it's right. If I rush, okay, right there, I've got two thumbs. So now I'm going to back off. I'm at one thumb. So I'm going to focus. I'm at one thumb. I'm at one thumb. I'm at one thumb. Now I'm moving towards myself. Okay. Now I'm still 1, I'm still 1, I'm still 1, I'm still 1. There. Now I'm at 2. So then I back off until it becomes 1. There. Now I'm going to go. Okay, I'm hitting 2 every time right here. I should be somewhere a little bit closer, and some people can even take it all the way in. Okay. So sideways, sorry. So here, and then pretend you hit 2 thumbs. So then you back it off. There's 1 thumb. Okay, oh, there's 2 thumbs. Back it off. Work it in, work it in, work it in, work it in, and try to train those. If you find, and that's why I say if someone else is there with you, they can look at your eyes and to see if one of the eyes doesn't drift off center. Now that means that eye may be picking up another letter, or it may be skipping letters. You don't have what we call convergence. That could be a problem, and you can train it out, just like what I just showed you. And if you cover, pretend it's a left eye weakness, and the left eye drifts all the time. You cover up the right eye, and then you train in the left, see what happens. Okay, train in the left, see what happens. Oh my God, it's perfect now. That kind of thing. You can train that in and out.
How do I figure out which one is weak?
That's why I'm saying, yeah, ask someone. Ask someone.
So my husband or my daughter see which one is
exactly
waving away from the thumb.
If it's that obvious, and like I said, with my daughter, you'd never know. One of my daughters, you'd never know. But when I do that, it's still there a little bit, and I work with her, and like a lot of people, we don't always do everything we should. But literally, that could be it, because a lot of reading problems, and you may have, and the mistake is, what we do is then we'll test our kids and see they have 20/20 vision. And they then, at that point, they just skip right over it, don't they? And oh, it's great vision, it can't be the eyes. Now, let's see if the eyes are working together. And let's see if the eyes go from, pretend it's a teaching scenario. I'm doing my notes, then I look up at the teacher, then I come back down. Now I've got to refocus, and I'm having a eye focus problem, right, with this thumb thing. So this is the distance, I'm cool with it. Then when I come closer and I'm looking at my paper, now I'm having that convergence issue. Now I have a reading problem, even though I look up and I'm 20/20.
Okay.
So it's a secret. It's a secret vision issue.
It's basically saying you're getting your eyes back focused.
And working together.
You're getting them back focused, basically.
And literally I use it for, it could be not just your eyes, but it could be a brain stem. Like I said, I'd run through some quick primitive reflexes.
Yeah, I know. I can tell. I probably have something to do with my dyslexia.
Oh my God, you're dyslexic too? Are you dyslexic?
It flares up. Isn't it weird? I just found out, but it flares up. Some days I can't even identify a number. I'm like, wait a minute. I know this number.
All right, then what you're going to do, if I can, you're going to check. You're going to check with your medical doctor first, because I'm not your doctor. That's my precursor. This is only for educational purposes only.
Right, I got it.
Okay, everyone. Everything I say is for educational purposes only. What you have here, dyslexia is almost always a weaker hemisphere on the left. That's where your verbal and your fine motor skills, and it's really pretty cool with verbal and reading, and dyslexia is usually an indicator of a weak left hemisphere over here. Weak left. So what you want to do is stimulate left hemisphere activities. You want red, yellow, green, red, yellow, green. I'm sorry. Red, orange, and yellow to stimulate the left hemisphere, right? You want red, yellow, or orange. Red, orange, or yellow is the way I prefer it, but if you like yellow, use yellow. Try using those glasses, colored lenses, when your dyslexia kicks up.
Okay.
I'm not lying. Try.
No, I know. Okay. I know, you're right. It helped. I'm serious.
No, yeah, absolutely. It's
we
like,
used to have bookmarks. You know, the teachers used to put bookmarks. So whenever we would read, I remember a red bookmark. You know, those it was like.
Oh no way! Yeah.
Yeah, you can put over the words like that, and I don't know what it was, but it helped. I don't know.
That is, you could picture then, that's a great idea because there is a whole, oh God, there's a whole color technique. I know a couple doctors that use it in their offices. I can't remember the name of it. I think it starts with an L, where they use color sheets and they'll find the exact color that makes.
The sheets.
Yeah. So
yeah,
you.
But it used to be like a little bookmark.
Yeah.
So they didn't want it to be on the sheet because our eyes will go all over the place. But it was just like this one strip, and it was like a clear. It's like see through, but it's red.
That's what I'm talking about. Get a whole sheet on your. Lay the whole thing over your book. That way.
Really?
Yes. Lay it like pretend I'm looking. Well, I am looking down, but pretend I'm looking. I'm looking at this paper, and I'm having a hard time. You lay your red, orange, or yellow sheet over it and see if that doesn't make everything easier for you to read because we're trying to stimulate your left hemisphere. Does that make sense?
Where can I get those red sheets at?
Oh man, you can get any see-through red, orange, or yellow based, if you were going to do like a kid's display, maybe a home. I'm not good at that stuff. What do they call it? Home and garden shopping, or
oh, okay.
Where you can go and buy
Michael's,
things.
I know I can go to Michael's probably. Yeah.
Oh, Michael's. Yeah, we have one of those in the plaza I'm in. There's also something right there with Michael's. It's called something else right there by our Michael's. There's Michael's over here, and there's this one right here. Yeah, but it's for the crafting is one of the words I was looking for crafting. And you
Joann's.
That's another one. Yes. See if you can't buy some inexpensive, really see-through sheets and see if one of those three colors doesn't help you.
So red, yellow, and orange.
Either one.
Okay.
Yes.
Thank you so much.
Just in case, for educational purposes only.
Yes.
But that may help you. That may help stimulate more left brain activity, and thereby that little boost could give you more focus. Your brain, your whole inner subconscious attention is focused in that left side, if that makes sense. So now you've got the cells or more, even subtly, more blood flow. There's a real cool toy out there that I have called a Mendi, M-E-N-D-I, that uses infrared measuring, and it has a targeted moving ball on your phone, even though it is a cell phone. And what it does is you watch the ball, you focus on the ball, and it's got colors on it and all this stuff. And that increases the blood flow to the frontal lobe. And it measures it up and down. Like those pulse ox devices, they figured out how to do it up here. I'm thinking the same thing could work here if you throw red down and your brain knows you're trying to read. So it should be, theoretically, it should be able to stimulate more blood flow and oxygenation to the areas and nutrition to the areas that you're demanding of. So maybe that'll help.
Okay. But I will say that the vitamin
Gymnema.
Yes. I see a huge difference.
No way. What difference did you?
So much better, but I haven't lost any weight.
I'm cool with that.
I feel so good.
Because imagine think about how if you are I'm so glad you said that, because that is such a cool plant that you literally can, if your cells are becoming more insulin sensitive, that means they're more appropriately pulling in the blood sugar to the cells for storage or usage or whatever's taking place. So your sugar regulation is the word. The sugar regulation is more under control. That's awesome. I think that's just so cool. Alhamdulillah.
I'm so grateful that you suggested it. And it worked beautifully. Alhamdulillah.
Alhamdulillah.
Thank you.
Yes, ma'am.
Assalamu alaikum.
Wa alaikum salam wa rahmatullah. Woo!
I'd like to ask, could that happen in any form of eye? Of the eye? Recently I saw a doctor, a specialist, but he was a specialist.
Yeah.
For the eyes.
Yes.
And he told me that because because he really seemed fascinated by my eye, especially my eye, because he asked me, was my eyes always like this? And I said, no. Because I don't remember them being like that as a child.
Like what?
But you see mine? Can you?
No, I only see mine. I gotta tell you. It's weird talking to myself all the time.
Let me see if I can get this video. Oh, come on, video.
Well, the idea is
It's off.
yeah, we actually I usually when I speak,
It's being done.
I prefer this, and I hate to say it, sister, but if we could, I prefer no videos, because if we make a habit of once or twice, like that one cat earlier cursing because we let his audio.
The thing is, one eye is totally looks normal, and the other eye
looks what?
not there.
Maybe I can help her a little bit. I had an off-cast eye just like hers. Either one of my eyes would go to the left. Instead of looking straight ahead, one eye could float away. The other one could do the same.
Yes.
When I was 14 years old, I had surgery with two muscles being pulled in the inner corner of both eyes.
Yes.
And I was able to hold my eyes straight. I'm still holding them straight. And it was a muscle weakness. If I had waited one more year, he said, he wouldn't have been able to do the operation.
Oh, okay.
So it's called an off-cast eye.
Yes.
Not cross-eye, but off-cast.
Yeah, the one of them drifts out.
Yeah, one of them drifts out. Hers actually stays out. Because she's an older woman, and it got permanently, it stayed that way because of the muscles.
Yeah, and when I think about it, especially with children or younger people, what we've got is, if it's a brainstem thing, the right side is controlling the right eye, the left side is going to be controlling the left side, except for, I think, cranial nerve 4, the trochlear. Anyway, the idea is that that's why I'm saying I'll check with that kind of stuff. I also check the brainstem to see if both sides are running equally. If I could give you the example like I did before of the gentleman that came in after a brain trauma, and he literally had a rooting reflex or a baby breastfeeding reflex on this one side and not on the other. So I knew, along with the brain trauma, his right brainstem was starting to overcompensate, or he was regressing, and the right brainstem was actually coming out more. So we had to light that up. We had to do some primitive reflex exercises to get rid of it. The same thing with eye movement, and that whether you can converge and diverge, it could be a cranial nerve issue if it's not surgical, like yours was corrected surgically. But sometimes we can correct it with brainstem stuff. The sister Layla wanted to ask me a question again.
That's amazing.
It really is. That eyeball stuff.
So far has been able to figure it out. Well, he said he could. He said he could fix it.
Yeah, absolutely. What they'll do, like Sister Anissa said, what they'll do is they'll tighten up what they can go in. The surgeons are amazing to me. The detail work that it's just amazing to me. And maybe he's going to clip it and tighten up the muscle that will pull it back over, or loosen up the muscle that's pulling it out. Whatever he sees in there, he may be able to do something with. And again, like I said, there's no surgical orientation for me at all. I've got to work on the neurological part.
Yes, that's something, because it made me think about when you brought that up too, because as an infant, there were some neurological issues.
Yeah.
He said as a baby, even as a baby.
I can believe it. Absolutely. Most of us have our issues, don't we? Yeah.
Because mine didn't actually go off until I was about 6.
Oh, wow.
And they put glasses on me because I couldn't see nearsighted. When they put those glasses on me, big old frames back in the day, I would peep out of the side of wouldn't look through the lens because I didn't want glasses. I peep out of the side. So that was one reason why that muscle got weak.
Yeah, I believe it.
And then my grandmother had to actually click her fingers in front of my eyes to help me to straighten them out. Because I was just a kid. I was relaxed. I didn't care which way the eye went.
Yeah, absolutely right.
And I got pictures of me, even at the age of 9 and 10, with my eye like hers, off cast. And I had that surgery at 14, and he wasn't sure it was going to work, but it did.
Alhamdulillah.
Yeah.
So that's what he wants me to do too. It's amazing
Dr.
because
McBride?
he says he'd have to bring down my blood pressure.
I got to tell you, sister, rub that parasympathetic stuff up here.
Excuse me, Layla.
Sister Layla?
Oh, I'm sorry. I was just going to tell you, Sister Layla left a message, and she said she has to go to the store.
Yes.
Okay.
Yeah, I saw that. All right, everyone. Well, if there's no more questions, we can all exit out. Remember, Sister Layla's class still on today?
Yes, inshallah.
Okay, inshallah, then everyone plan on that, and we will get together again here next Thursday, inshallah. And if you have any questions from today, again, you can ask them next week too. You can try the games, try everything I said, look at her videos to see if you can pick up some things that you may have forgotten about the instructions I gave you. And we can review at the beginning or the end everything I went over today, because we covered the frontal lobe, the parietal lobes. We talked about the trigeminal nerve. We talked about the vagus nerve. These things are all super, super important, and I have no problems revisiting them again to make sure we get this stuff that you can do at home all day, every day.
You should leave us with 3 words and see if we remember them next time.
Yeah. You got to promise not to write them down.
See, but this is how I learn.
Okay.
When I write something down.
No, you can't.
This
is strict. It's not learning. It's memory testing.
Yeah.
You ready for my 3 words?
Yes.
I'm not going to do it.
I'm literally.
I'm gonna do it.
I'm
Since
going.
I can visualize it. I can do it.
I'm going to circle 3 words randomly off of my paper today.
Okay.
And you are going to, there's 1 word up there. I'm going to move down to the middle of the page, and I'm circling that one. I'm going to go down to the bottom of the page. Oh, those words will be easy to remember. Okay, I'm going to circle this one. Now, no one write these down. Don't cheat. This is practice.
I promise I won't.
Yeah, I'm going to, Allah is watching us.
No, I'm not going to do it.
So seriously, ready?
Oh, gosh.
Are you ready?
Yes.
And if you remember 2 of the 3 words, that's normal. If you remember all 3, that's above normal. If you remember all 3 in order, you're killing it. Now, share these words with someone that lives in your house and see if you remember them tomorrow morning too. Because the test is actually like an hour later. But this is it. These are important. Sister Layla, I'm calling you out next week. In a good way. In a good way.
Let me ask you something.
Yeah.
If I can write them down, and then I'll tear up the piece of paper. I promise I will. It's just I have to visualize some things. That's how it sticks with me.
I'm cool with visualizing that. But you know what? Your way is actually scientifically validated, and I like it. I'm not even criticizing it. Writing things down rather than typing actually stimulates more motor centers and more integration for the memory centers in the hippocampus, and mainly the hippocampus, how they all tie into the hippocampus together. Does that make sense?
Yes.
So writing, when I take my classes, I literally handwrite my notes, and then I review my notes, and I write fine detail stuff, and then I rewrite into a notebook what I consider the most important, if that makes sense. So I can appreciate your writing and learning. I love, I'm old school. I write and I learn and I learn and I write. So you do what you have to do, but I don't want you writing them down every day.
No.
All right.
I won't.
My first word, games.
Games.
My second word, above.
Above.
My third word, deep.
Deep.
Done.
Games above deep. Games above.
Yeah.
Games above deep.
Yes.
I can make a song out of it. That's how I remember too.
Games above deep waters.
Oh, sister, you shouldn't have thrown that out there. That was my thought too.
No waters. Don't say it. Games above deep.
So those are the three words. I've got to make sure I keep this right up front and I don't misplace it.
Games above
I like
deep.
that. I like that, Anissa.
All right, sisters.
I'm a songwriter. I'm a poet like you.
Yeah.
So that's how I learn.
That's cool.
That's how I memorize Quran. I put it in music. It goes in my heart.
Alhamdulillah. Alhamdulillah.
Alhamdulillah.
All right, inshallah, that's what we will do for next week. I will remind me to start with that.
Okay.
All right. Assalamu alaikum, everyone.
Walaikum
Subhanaka
salam.
Allahumma wa bihamdika wa tabarak ismuka wa ta'ala jadduka wa Allahu akbar.